Hi there, I'm Robert Howard, and I'm a member of the board of Tune In and Tune Up. Today, we're here to talk about HealthSource Rhode Island, and we have with us Jordan Banick, who's the Outreach and Communications Manager. Welcome, Jordan.
Thank you for having me here today.
Let's start with the obvious question. What is HealthSource Rhode Island?
HealthSource Rhode Island is Rhode Island's official state marketplace for health insurance. We were created by the Affordable Care Act to help individuals, families, and small businesses find and compare high quality, affordable health and dental insurance plans. We are the only place where Rhode Islanders who qualify for tax credits to lower insurance costs can receive those tax credits.
You mentioned tax credits. Can you tell us about the tax credits you offer?
Yeah, as I mentioned earlier, the Affordable Care Act created the state based exchanges like HealthSource, so we administer the federal tax credits, which means that if someone qualifies for a tax credit, the credit is paid out monthly to help reduce the monthly premium cost of the person enrolled. Depending on the cost of the plan, tax credits are often available for people with an income of up to 400% of the federal poverty level.
How is it funded?
HealthSource operating expenses are primarily covered with a fee assessed on health insurance carriers. We get a small amount of state general funds, but are primarily self sustaining.
Who does it support?
HealthSource serves Rhode Island residents who need affordable health coverage. For example, maybe a person doesn't have coverage through their employer or is self employed. They could purchase health coverage through HealthSourceRI. Also, we have a test called Is Your Employer Coverage Affordable? For an individual, you can look at what the cost to you would be through your employer for coverage and then compare it to purchasing a plan through HealthSource. If it is less expensive, someone could purchase coverage through HealthSource. For example, maybe an employer covers 100% of the premium for an employee, but not their family. It might be more affordable to purchase coverage on the exchange for the rest of the family. Someone might also turn 26 and age off their parents' health coverage and could get coverage through HealthSource. Or perhaps someone's income has increased and they are no longer eligible for Medicaid. They could then purchase coverage through HealthSource. Through our HealthSourceRI for employers, small businesses and nonprofits with as many as 50 employees can purchase health and dental coverage for their employees.
How and where do people access these services?
People can get help from HealthSourceRI by calling or live web chatting with our contact center reps at 1-855-840-4774 or going to healthsourceri.com. The contact center is open from 8 a.m. to 6 p.m. Monday through Friday. You can make an appointment to visit in person. People can also use our certified navigators and get connected with a navigator agency by calling 211.
What low cost or specialized plans exist for self employed or gig based music workers? And are there any compromises with things like deductibles, networks, and exclusions?
Yeah, HealthSource offers a range of plans from both Neighborhood Health Plan of Rhode Island and Blue Cross Blue Shield of Rhode Island, and 4 different levels to choose from: bronze, silver, gold, and platinum. For example, gold and platinum plans have higher premiums but lower out of pocket costs and lower deductibles, while bronze plans come with lower premiums and higher out of pocket and higher deductibles. Some plans have a network limited to the Brown University health system. All plans on the marketplace cover 10 essential health benefits, including preventative care, emergency care, and mental health care. There may be visit limits on certain services. Coverage cannot be denied because of a pre-existing condition. Tax credits and cost-sharing reduction plans minimize out-of-pocket costs and are available based on income. We also have a shared data system with Rhode Island Medicaid, which means if someone is income eligible for Medicaid, HealthSourceRI would be able to sign them up for coverage.
How can members of our music community with fluctuating income qualify for subsidiaries or financial assistance?
HealthSource uses your annual income to calculate the amount of financial help you can receive to reduce the cost of your health insurance. To determine eligibility, HealthSource will compare your household income to the federal poverty level, a measure of income based on household size. Keeping your income accurate and up to date helps you receive the right amount of financial help, including no cost Medicaid if eligible, and avoid any surprises at tax time. Medicaid eligibility is calculated based on current monthly income. Eligibility for tax credits and cost sharing reduction plans for marketplace plans are calculated based on annual income found by multiplying the current monthly income by 12. In the case of uneven income or changes to income throughout the year, it's important to update your income with us, and your projected annual income will be updated. The goal is to connect you with as much financial support as you're entitled to, but not to offer you more than you're entitled to, because then you may be liable to pay it back at tax time.
For our music community members who have chronic conditions or injuries, what should they look for to avoid gaps in coverage?
Examine the details of the plan in the rate sheets available through HealthSourceRI. Use the Physician Finder tool on the carrier sites and contact the carrier with any questions about specific plans. If you have a provider relationship you feel strongly about keeping, verify with their office that they are in the network before selecting. As mentioned above, there may be limits on visits for certain services.
Wow, this is some pretty complex stuff.
Yes, it can be, but I encourage your community to begin by going online and first getting familiar with the services we offer. The HealthSourceRI calculator tool is a great place to start. You can access this by going to healthsourceri.com/calculator. The tool does not save any personal information and will allow someone to put in their annual income, household size, to estimate their insurance coverage costs. Additionally, you can put in up to 6 doctors and 10 prescription drugs, then compare plan. It is really helpful to gather all the financial and personal information you might need. This includes your zip code, your age and the age of your family members, photo identification, proof of citizenship or lawful present status, a social security number, and an annual income, which might be your pay stubs or your last tax return.
Thank you, Jordan. We appreciate your time and the wonderful services of HealthSource Rhode Island. At the end of this video, we will leave a list of important website links and contact telephone numbers. Freeze your screen and write it down, or just take a photo. That's it for now. Thanks for watching another Tune In video workshop. Take care.